All right, so we have Carly here for her first adjustment. And as always, we're just gonna go back and we're gonna check everything. This was strong the last time, but you have muscles in your arms related to the nerves in the neck. So hold the arm up, push up here. We can test the muscles and it tells us about the nerve flow. Very good. And push up. Okay, and then go ahead and lay on your back. Carly's coming in for a lower back issue, and there's always compensation in the neck, so we always want to check that to make sure we're not missing anything. We've already done an exam, so we know what we need to do, and this is what we found last time. Raise this leg up and push up with the leg. Okay, see we have a little weakness here. This leg is related to the L4, so if this leg is weak, tightens up the hip flexor, tightens up the back, causes back pain. Raise this leg up, hold right there, and push up. See how strong that side is? That is your normal strength. Okay, so we have an L4. Now I'm gonna come down here and check the leg length. The legs are level. And I'm gonna check the hips. So I'm gonna turn your foot in here. Goes in almost 90 degrees. And we'll go here. See how it stops right there? So it's a little bit shy. So we also have the right hip, the left hip turned out. So what we're going to do now is we're going to adjust the L4. We'll come back and check it, okay? So, lay on your side, facing over here. Now bend the knee. So when we bend the knee up, it actually causes the vertebrae to rotate. And so it opens the hole also. It allows the sacrum to kind of flatten out. And the holes that the nerve passes through, it opens it up. So it frees up the space. Here. We'll get you in the side position here. And what I'm going to do is make a little adjustment here. So just relax. I'm going to roll you towards me a little bit. Put it back in place. Go ahead and lay on your back. Did you feel that? All right. The next thing I'm going to do is the hip. The hip, it doesn't feel like I'm doing an adjustment. I'm just going to do 3 little pushes right here. 3, okay? And we're going to go back and check it. The good thing about chiropractic is what we're trying to do is we're trying to reconnect the brain to the body. So it's definitely more electrical than trying to move it and trying to get, a lot of clicks or pops or what have you. Hold the leg up and push up here. But see, now we have strength. Push up here again. See how it's a little bit stronger? Push up here. So the muscles should be strong 3 straight times. And then we check the foot. See how much better it turns in? So it was about right here. Now it's turning all the way in, which is great. So if for some reason we were to make the adjustment and it would still be weak or still not turn in, we would go back and redo it, okay? Okay, so now we're gonna check the hip flexor, the psoas muscle. Bend the knee, bring your knee towards your right shoulder and hold it tight. 1, 2, 3. Come back here, hold that leg up and push to the right shoulder. Okay, see we have a little weakness here. So it just means that hip flexor is a little tight. So when you sit or bend, the muscle contracts. When you stand up, it's staying contracted, so it's going to pull the back. So hard to get up out of a chair, hard to get out of the car if you've been driving. And so we're going to use a percussor to work on that trigger point. Okay. The percussor actually, it vibrates and it oscillates at the same time. It works really good. I'm just going to put it right here. You okay right there? And bend the knee. Put it on top of my leg and relax right there. How's that?
That's good.
Okay, and I'm just going to hold it right there. This is a strain counter strain technique, and what that does is it allows the muscle to actually lengthen up. So if we don't work on the muscle, the first time you sit long periods, all this is going to get pulled right back out. So we're trying to make it long lasting if we can. All right, and then go ahead and take a breath in and hold it. And let it out, nice and easy. We're going to put it right back down. Okay, good. Now we'll go back and check it, make sure that was enough. Bring the knee towards your right shoulder and hold it tight. 1, 2, 3. Come back here, hold that up, and then push to that right shoulder. Very good. So see how it's strengthening? So I'm going to give you a little pull here, and then bring the leg off the side. I'm going to give you a little pull here. Good. All right. So now we're going to check the neck. just going to check your rotation. I'm just going to turn you this way. Good rotation to the left. See how it stops right there to the right? Okay. So what we're going to do is just right where it stops, I'm going to take it where it stops, and I'm going to put a little movement right there, and then we recheck it. See how much better it turns? So just that one little click, it resets the muscle, and helps it out. So let's go ahead and lay you on your stomach again. All right, next thing we do is check the pelvis. We can use muscle testing to retrieve the information. Hold that right there, push up against my hand. Good, strong here. I'm gonna press the SI joint on this side, push up against my hand, and see how it weakens. And so that just tells us that the pelvis is rotated back on the left. So we had the left L4, we had the left SI joint, we had the left hip, we had the left psoas, and then I'm also going to check the muscle, the hip muscle in the back. So I'm going to stretch you here, 1, 2, 3, push you into the right towards me, good and strong. So we're going to make an adjustment at the SI joint on the left, and then I'm just going to kind of go up here. See, like right in there is a little tight, and then kind of right in there. So I'm going to do a little adjustment here, take a breath in, and let it out. I'm just going to put a little movement right here. One more time, breath in, and out. Okay. And then lay on your side, face me over here. Alright, and then bend the knee. Right there. Straighten that leg. Right there, okay. Arm, elbow, good. So the adjustment is actually going to be the opposite side, down here. I'm going to roll you towards me a little bit. Good. One more time. Right there. Good. Good. All right. Let's go ahead and sit you up. All right. And then I'm going to fold this, sit and face this way now. Okay. So now we're going to make an adjustment for the mid-back. And so as we have stress, everything we do is forward. And so the stress of being forward, we start doing this as we get older. You know, start hovering over a computer or whatever. And so what happens is the vertebrae actually go forward out of place. So what I'm going to do is I'm going to put my hand on the one underneath it, and we're going to bring it back and put it back in place, which is going to give you a better posture. Because if you're going forward, it's going to put more stress on that lower back. So let's put this arm right here. Put this one a little underneath. We'll make an adjustment right here, so just go ahead and lay back. Take a breath in and out. Good. All right, and then back, breath in and out. Good. All right, very good. We'll just do a little stretch here. Stretch the neck back. All right, Carley, go ahead and stand up. See how you feel. That is a treatment.
Good.
Feel a little better?
Yeah.
A lot of times you'll feel like you can straighten up a little better. Sometimes the pelvis feels a little lighter. So, yeah, very good.
Really being able to move my like all that way, that's good.
Absolutely. So now we're going to put you on the table in another room.
Okay.
We're going to put the rollers on you. We're going to do the ice. We're also going to do the laser on you.
Okay.
And we'll kind of go from there. And then every visit we'll just follow up. And hopefully everything keeps getting better and better.
Yeah,
All right?
okay.
All right.